served in government before, much less the House of Delegates or the Senate. And we have a great history. And people need to know where we've come from.
That's longtime Maryland Senate President Mike Miller getting visibly choked up as he called the chamber's legislative session to order today. He also announced that he's now living with prostate cancer, and he'll be undergoing some continuing treatments while he presides over Maryland's Senate.
Can't remember when he wasn't there. Sources close to America's longest-serving Senate president described the cancer as aggressive and advanced. Our reporter Scott Broom has reactions from other men living with the illness.
Prostate cancer in men is more common than breast cancer in women. If it's caught early, many men will die of old age before the cancer takes them. But in cases where prostate cancer moves to other parts of the body, the prognosis is not good, which is why Maryland illustration artist Harry Campbell
Affects every decision you're making. So
is concerned for Senator Mike Miller.
It's a big deal, yeah.
Campbell, who's living with the cancer himself, says men need to be more aggressive than the cancer when it comes to getting checkups and screening.
I've had men say they don't even know what a prostate is. A lot of men don't even go to the doctor, don't even do physicals, and the last thing they want to deal with is something that has to do with their prostate or the reproductive system. It terrifies them, so they'd rather not even deal with it. Whereas a woman will go and get breast cancer screenings. Almost all women do it, and it's important.
Campbell's a renowned Maryland illustrator whose work you've probably seen in major newspapers and magazines, and he is living with prostate cancer that's gone beyond the gland.
All men, especially all men over 40, should get a PSA test at the minimum and just kind of every once in a while check it, because if you do catch it early, it is very curable.
A simple blood test called PSA that indicates if cancer may be active is the key.
The thing about a PSA test is it's just a blood test. You can go to a lab, you can go to your doctor, you can get it done at a physical. It's not invasive at all. It's just if you're getting your cholesterol checked, you can get your PSA checked.
If you wait till there are symptoms, you've waited way too long. But you got to get screened to know. Scott Broom, WUSA 9.
Campbell told us there are two things that men should ask doctors when discussing PSA test results. The first is about velocity, and that's how fast PSA levels are changing over time. And the second is you'll also want to know how frequently follow-ups should be done.